Thank you everyone for taking the time to come on to this webinar. What we're going to go over today is an overview of the 2017 COC NOFA, but before we start, I just want... All right, well, great. Again, even though this is an overview, I hope that people will feel free to chime in if they have a question throughout the presentation. So I'm hoping this will be about half an hour to 40 minutes, and that includes all of the questions. And of course, if there are any additional questions after the fact, please feel free to contact me directly or, of course, any of CARE's COC staff. So I want to talk about the goal of the webinar. So it is to provide a systems level overview of the NOFA, and I just want to be clear because there is so much that goes on during this period of time. Some of it is kind of an overview, and then other things are very nitty-gritty. So I just want to be clear what this webinar will not be going over, because we do have other webinars and one-on-one technical assistance sessions that will go over other things. So we're not going to go over detailed project level information, and we are not going to go over any eSNAPS technical submission directions or eSNAPS at all, because I know that's a little nitty-gritty. And what we really want to go over is the main points of the NOFA. What we are going to go over today, though, is we're going to talk about important NOFA dates. So from now until the end of September, there are some deadlines that are important system-wide, and then there are some deadlines per COC that we will talk about a little bit. We are going to provide a general overview of the NOFA. We're going to talk about the 2017 policy priorities. We're going to review important systems level changes that HUD is making through the NOFA. We're going to talk about the NOFA criteria and the scoring, and we're going to discuss next steps. And at the end, there's time for questions, but again, feel free to ask as we're going along. So, important NOFA dates. So the NOFA was released on July 14th of this year. But the application was not made available for either the full COC, which that's called the consolidated application, nor for the project applicants, so your own project application. It wasn't made available until the 19th. So there was a short period of time where we had the NOFA, which talked about the direction HUD is going in this year, to when we had time to actually go in and see the questions that are being asked, both of the COC as well as the projects. Detailed instructions for the applications, they noted, will be available on or after July 31st. However, I do just want to say they are already out. So I didn't want to change my presentation, which was made earlier this week, but almost all of the detailed instructions in order to complete your project application, as well as for CARES staff to start completing your COC consolidated application, have been put on the website. That came out on Monday in drips and drabs, and I think was totally complete by Tuesday of last week, or Wednesday. It happened Wednesday of last week, and it's fully complete this morning. So all COC applications must be submitted by September 28th. So I just want to be clear on what that means. The COC applications are the full applications of your community. So that includes what's called the priority listing, which is all of your community's applications chunked together, as well as the consolidated application, which is what CARES works on. Both of those pieces have to be submitted to HUD by September 28th, 8 p.m. Our goal is to submit at minimum 5 days early. So we did want to give a general NOFA summary. So this is just the really important stuff that's not too nitty-gritty, but it's important for everyone to know. So HUD the government has allocated $2 billion for the continuum of care competition. However, this may not be sufficient to fund all of the eligible renewals. So that always makes us a little bit nervous. There was not a decrease in funding for continuum of care. It was actually flat funded. But the issue with continuum of care funding is that if you don't give continuous bumps to it due to the fair market rent increasing annually, it actually is a decrease, which is what happened. So HUD is offering a permanent housing bonus, though, which is possible additional dollars for communities at 6% of the continuum of care's annual renewal demand, or their full renewal allocation of 2017, which I'm going to go over in a minute. So I see a question came in, and I will answer that in a second, Marcia. Thank you. HUD is allowing, let me just go back a second. HUD is allowing new projects to also be created through reallocation. So you could create new projects through the permanent housing bonus or through reallocation, which means that there are current funds within your continuum that are being given back to the full community. So it's not additional dollars HUD is giving, it's just taking dollars that are already within your community and creating new projects. So HUD is, again, requiring that communities tier their projects. So Tier 1 is 94% of the current award or the annual renewal demand, and then Tier 2 is 6% of the reward, so the remainder, plus if you apply for any bonus. Planning projects and any UFA costs are not part of the tiering, but I do want to stress what's going on with Tier 1 and Tier 2, because I think it is important. So Tier 1 are projects that are pretty safe. HUD will grant those projects because the community is telling HUD that those are the priority. Tier 2 projects, any projects that fall into Tier 2, it could be renewal projects, it could be reallocated projects, it could be bonus projects. All of those are put into separate competitions nationwide. So for your renewal and your reallocated projects, HUD is scoring them on 3 separate criteria. So it's important to read the NOFA to understand, if you are in Tier 2, what those criteria are. The most important of the criteria is the full score that your community receives. So that consolidated application that care staff works on with the community. That is the biggest chunk of how you're going to score. Your bonus projects, regardless of where they are put within your tiering, go into a third type of competition, and that is looked at separately from Tier 1 and Tier 2. So bonus projects are really the last to be funded, because it's if there is additional dollars, or if HUD wants to shift dollars from current renewals and reallocations to the bonus. And every year that's slightly different. So CARES is collaborative applicant of 9 COCs within New York State, and I thought it was important because I know we have folks from multiple COCs on the phone to know what their annual renewal demand is, what their tier 1 would be, what the planning amount would be, and then what your actual bonus works out to. So again, your bonus is not based on just one criteria if you get your bonus. It's based on 3. And again, I don't want to go into nitty gritty, but if your organization is interested in applying for the bonus, please, and I'm going to go over it a little bit, please make sure that you understand the criteria of the bonus projects. So part of the criteria of getting a bonus project outside of your COC scoring well in the big application is also understanding the policy priorities of HUD and ensuring that your project not only meets the eligibility criteria, but is also following in the footsteps of the policy priorities that are set up in the NOFA. So here are the 4 policy priorities that are set, and none of these are really a shock. HUD still is using the Federal Strategic Plan, which is opening doors, as their base to setting priorities annually. So again, none of these are really a shock. So the first is ending homelessness for all persons. The second is creating a systematic response to homelessness. The third is strategically allocating and using resources. And the last is using a housing first approach. So HUD is really clear in the NOFA what they expect communities to be doing in order to follow and meet these priorities. So with ending homelessness for all persons, COC should identify, engage, and effectively serve all persons experiencing homelessness. They should measure performance based on data. And as they're doing that, they need to take into account the challenges faced by all subpopulations experiencing homelessness. This year, HUD is focusing on youth, DV, and vets. COC should have a comprehensive outreach strategy to ensure that unsheltered individuals and families are being engaged on a regular basis and linked to services. COCs need to prove that they're using local data to determine the characteristics of those who are homeless and identify those with the highest needs, and then develop housing and services that meet that need. COCs also need to be using the reallocation process to create new projects that improve their overall performance in order to better respond to the needs of the community. So looking at these bullets, just overall, your coordinated entry system plays a huge role in meeting this priority. So within the large application, a lot of the information HUD wants to know is how we're using coordinated entry to engage and identify those who are most vulnerable. This area also looks at how communities are using their system performance measures to make some choices on what programs need to be created. And the last link there is once your community uses coordinated entry to look at who's in the most need and most vulnerable, once you're using your system performance measures to identify your lengths of stay and your housing stability, you should then be using the reallocation process, which occurs right now during the application cycle, to look at all your programs and say, well, you know what, maybe we need a program that effectively serves possibly youth or possibly those who have a connection with prisons or jails. So HUD is expecting that the priority of ending homelessness, you're using all of those tools that you have, your coordinated entry, your system performance measures, and the reallocation process. The second priority is creating a systematic response to homelessness. So again, HUD is really looking at system performance and coordinated entry. So COC should use system performance measures to determine how effectively people experiencing homelessness are being served. So what your system performance measures look at is recidivism, length of stay, housing stability. If your community is increasing its length of stay within emergency shelters, there should be discussion on how to move that needle down. And so HUD wants to see how you're doing that and that you're looking at it on a regular basis. Also, COCs should be using coordinated entry to promote participant choice, to coordinate homeless services with other mainstream housing and services, and to ensure that homeless assistance is provided quickly, that it's open, that it's inclusive, and that the community sees it, that it's transparent on how the system works. The next priority is strategically allocating and using resources. So again, this goes back to your reallocation process and really understanding what services are needed in your community at that point in time. What HUD is saying is that even if you have a project that's been operating for 10 years, it may have been very effective 10 years ago, it may have been very effective 5 years ago, but today your population, your homeless population could have shifted. And so continuums are not stuck with just continuing to renew projects just because they were in operation the year before. We could use that money, look at programs that are necessary, and shift it to change our projects. So in order to do that, HUD really clearly lays out what COC should be doing. So COCs should be using cost, performance, and outcome data to try to improve to see how resources are being utilized and use them in the most efficient way. COC should be reviewing project quality, performance, and cost effectiveness. And I know that people in the past have questioned why HUD looks at leveraging. I know leveraging has been kind of a sore point for our COC-funded folks who in the past had to document it. HUD is now looking at how your continuum uses mainstream benefits and other community-based resources as a whole, not as a project. So how your agency leverages mainstream benefits and other resources is really important to your full continuum score. So unlike in the past, if you are an applicant, unlike in the past where you had to document your leverage, now it's care staff who may be contacting your agency asking you about what mainstream services you use and if you have memorandums of understanding with mainstream services, because HUD is now looking at it more system-wide, not program-based. Another point that HUD makes in the NOFA is that COC should review all renewal projects to determine if they are actually serving people effectively. And effectively also means cost effective. And I know a lot of continuums have struggled with trying to identify cost effectiveness, but this is the second year in a row that HUD is talking about that, and I don't see that stopping. The last, but definitely not least important priority that HUD has is that COC should be using a housing first approach. So COC programs really should be, one, moving clients through into permanent housing quickly if that's what's needed. And the COC should measure how each of the projects is reducing the length of time that someone that a client is homeless. So that's the beginning portion of Housing First, where projects really shouldn't be setting up barriers to entry. Now, what's interesting is the second point that HUD makes in the NOFA, which is that COCs really need to remember to start engaging landlords and property owners as part of that removing barriers to entry. So that's interesting. And then they note that really projects that are not adopting client-centered services or not meeting clients where they're at, that also is not going to foster the housing first approach by keeping folks housed. So not only is it the barrier piece, by kind of breaking down those barriers at entry, but also breaking down those barriers to stay stably housed as folks are in your projects. So I want to pause there for a minute because I know that was a lot, and I want to open it to questions. Okay, so I know that there was one question that came in. So Marcia, are you still on the line?
I am.
Okay, could you ask your question?
Well, I wanted to know, again, I've recently come into this, so I feel like I'm a little behind the eight ball here in terms of what all of these terms mean. What I wanted to know is you're talking about an application that is due on September 29th, but my question was, who's responsible for writing that? Are you talking about the county? Are you talking about CARES? Are you talking about individual programs? Is HOCAS supposed to be writing an application? I'm confused.
Yeah, no, and I think that's a great question, so let me clarify. So the application that is due to HUD on September 28th is the community application. That is completed and packaged by your collaborative applicant, which is CARES. So it's CARES' responsibility. Say that again?
Who is the community?
So it is the COC members. So if you are COC funded or if you are part of membership, what CARES does is package it together and we put it online for comment. We also may be reaching out to get some information in order to complete the narratives. So that's one piece of the COC application that CARES is responsible for, with your help. The other piece of it, though, for agencies that are COC funded, who actually receive money through the program, you do have to complete your own project level application. That project level application has its own deadline because, again, HUD requires that the community is able to look at it. So each continuum has received a continuum-specific timeline from Jennifer Topankin. And if you haven't received it, Marcia, you could talk to me offline and I'll send it to you. So your funded agencies are responsible for their own project application. CARES is responsible for the large narrative application. All of that has to be packaged and given to HUD by September 28th.
Thank you.
No problem. That's a great question and clarification. Are there any other questions? Okay. So I did want to talk a little bit about the actual criteria, so the scoring of the application. So the NOFA always details what HUD is looking for and talks about the point value of each of the areas. So the application this year is worth 200 points. and it's broken down into multiple sections. So it's the COC coordination and engagement, project ranking, review and capacity, HMIS, point in time, system performance, performance on strategic planning, and then there are these bonus points this year, which unfortunately none of the 9 continuums that CARES works with are able to get. So those bonus points are only if your continuum merged with another continuum within the 2016 fiscal year for HUD, and none of us did. So what I do want to go through how scoring compares to last year, because I think it's important. All of the continuums that CARES worked with last year scored relatively high on the 2016 NOFA. And so we kind of take that, not that you could ever really compare, but we'd like to take that to see how different this year's scoring is, what HUD added, and if the point value shifted in any way that we would be surprised. So I just want to go through just a highlight of some of the changes. So in the COC coordination and engagement, which is worth 43 points this year in the FY17, it is exactly the same as last year. However, HUD did add 2 separate areas and just shifted points from the others. So this year there is specific questions regarding how the community addresses the needs of LGBT individuals, and that's worth 2 points. They also broke out discussion about outreach, and they broke out affirmative outreach, so how projects reach out to those most vulnerable, from just street outreach. The second section is project ranking, review, and capacity. So last year there was a typo. HUD had a typo, and it was incorrectly noted as 30 points, but when you added it up, it was only 28. So what we believe is that it went up 1 point. So 29 points really focus on what your NOFA committees are doing, or the committees who are doing your rank and review tools and process. So that's a large chunk. So they did add 1 area, and then they shifted some points about the severity of needs and performance. So this is where they are looking at how continuums are taking into account specific populations, and how you're using data to make sure that you are balancing the needs. So one specific subpopulation that they're looking at more this year, and how we use their data, is domestic violence. So how are we, when we're doing rank and review, how are we ensuring that DV programs are weighted appropriately? Are we using their data? Is it narrative? So they're just getting a little more information from COCs, and they connected 4 points to that. They also, within that area, are looking at chronic homeless, mental health, and substance abuse. HMIS is the next criteria, the next section. And this year it's worth 13 points. Last year it was worth 18. However, don't let this fool you, because what they did is move a lot of what used to be in HMIS to system performance, and then they shifted some point in time information also into system performance. So you'll see that criteria grew a lot. So HMIS is 13 points. The one new criteria they have is AHAR submission. So I want to talk about that. So your AHAR is your community's annual homeless needs assessment, right? Your AHAR. So that report goes to Congress, and the only data that is included within that report is data that HUD is confident in, meaning that they look at your HMIS, they look at what you're reporting on your housing inventory chart, and they say, okay, is all the information that we're getting from your annual homeless assessment report, which is only data that's taken from HMIS, is it a good representation of what your community actually looks like? Do you have enough demographic information and enough participating agencies that are noted on your housing inventory that are reporting into your HMIS? And so if you have a bunch of beds in your community that are serving the homeless and are dedicated to homeless, but are not within your HMIS, Congress does not see your data because HUD does not feel confident in showing that it's an actual representation of your community. So in the past, HUD used to kind of give communities like kind of just like a check mark, where as long as you tried to submit, even if it wasn't accepted and showed to Congress, they gave you points. This year, they're stopping all of that. So the only communities that are able to get those 2 points are communities that had all of their information accepted by HUD. And within the 9 COCs that we work in, there are only 2 that are able to do that. So this is definitely, we knew it was coming. HUD is really focusing on ensuring that we have data for the homeless population. And so this is something that all of our communities will definitely talk about after the competition, because what we're feeling is that these points are going to be worth more every year going forward. So we're definitely going to need to work on that as a community. Your point in time data, the value was decreased by 3, so it's worth 6 points. However, again, this was just shifted to the next criteria, which is system performance, and I'll talk about that in a minute. Within point in time, HUD shifted some points here and gave a specific 3 points for a narrative that talks about how your community focused on effectively counting youth. And so again, we knew this was coming because HUD is really focusing on communities counting youth separately as well as combined during your point in time. They want to make sure that the youth population, which is a hard population to count, is engaged. And so they dedicated 3 points this year just for that. System performance had the biggest bump. So last year it was 40 points. We actually think it was 41 because HUD added wrong. But this year it's 49. So that is a huge chunk of the application. And again, we're not surprised. It looks at the 7 system performance measures. It allows us to narratively discuss how our communities are doing. So this was the first year where we have 2 years of data to compare. So within these points, you'll notice all of them increased. The biggest reason it increased is because HUD is going to give points to communities who saw, for example, a decrease in the number of folks who are first-time homeless. However, if your community had an increase in the number of people first-time homeless, it's not that HUD is going to zero out those points. There are additional questions about what you're doing to address the issue, and who's involved in addressing the issue, and then who is overseeing that the issue is going to be addressed on a regular basis. So even though these point values are very high, some of them have to do with how your community is planning, not just the actual decrease or increase in the performance measure. The last piece of this is performance on strategic planning. This is exactly the same as last year, and this is exactly what's noted within the federal strategic plan, the opening doors. So it looks at ending chronic homelessness, ending homelessness among households with families, children, ending youth homelessness, and then ending veteran homelessness. And all of those points stayed exactly the same. So there are a couple of notes that I put here, but just to sum them up, really what HUD is looking for in this application is your system performance measures, your plans on how you're going to end homelessness, and how your data quality is helping to assist your community do the other two. So again, coordinated entry plays a big role, system performance measure and data quality play a big role, and strategic planning plays a big role. Any questions? I know that was a lot. Okay, so next steps for continuums. So COCs are, some of them are in the middle of completing the rank and review process, others are already done, but the next steps is to finish up the rank and review process and get approved priority listing from the boards. So we would be doing that over the next couple of weeks. CARES is going to continue to provide both community-wide and project-level technical assistance. So that means if you're interested in applying for a bonus project, please let us know, and we will work with you on eligible projects, and we'll work with you on how to go into HUD's electronic system in order to apply. If you're a renewal project, there are some changes in how you renew, and CARES had an eSNAPS, will be having an eSNAPS training on the 3rd and then again on the 9th to kind of go over that information. And of course, we always do one-on-one. If you have any questions, contact us. We are going to be putting out the consolidated portion of the application for community review. So we do that within about 30 days. So by August 18th, that's when we're going to put it up for the community to start looking at what questions are within the application and what we already started to answer. We update that application on a weekly basis because it's not a static application. We're constantly getting feedback. We're constantly updating our data to make sure our numbers are right. So we really encourage you to look at the application, which is online, and comment so that we could improve the application. We do need COC approval of both the consolidated, that big application, as well as the project ranking and review. And the application will be submitted to HUD prior to September 28th. We never like to hold it to the last day because there have been, in the past, technical issues within HUD's electronic system, and we don't want to chance it. So again, the timeline for each of the specific project applications depends on what COC you're in, and Jen has sent out those timelines. If you don't have them, please contact me and I'll make sure that you do. I also believe that Jen had put them online. That's what I'm being told. So you could also look online. So just a couple of important links. The NOFA itself, which is about a 70-page document, is available. There is some new information about a new component called Joint TH and RRH. That is a new project type that HUD is allowing this year. And there is also information about what's called Dedicated Plus projects. This is also important for renewal agencies because you are able to shift who your project could take if you're interested. Again, the Joint TH, RRH component and the Dedicated Plus projects will be discussed during the eSNAPS training. And it was discussed if folks came to the new project webinar that we had, which is going to be, it was recorded and it'll be online if you're interested, if you weren't able to make it. Are there any questions? Okay, so again, if anyone does not have the timeline, the community timelines, feel free to give me a call or shoot me an email. Again, please remember that a lot of information is going out over the next couple of weeks regarding the COC, and we encourage you to go onto the website, onto CARE's website, and look at your COC specific page in order to see the most updated information. So I thank you for coming on, and I hope you will join us for the eSNAPS training either on the 3rd or the 9th for those of you who have renewal applications. Thank you so much.
Thank you, Michelle. Thanks, Michelle.